Let's watch it. Hello, good afternoon. I'm Marcio, President of the National Confederation of Insurance Companies, CNseg. That's the acronym, but that's not the name. And I'm deeply thankful for this initiative for having invited me to moderate this panel, which is about a topic we'll talk about improving access to economic recovery. And with this, we'll have Carmem, Zanotto, José, Camargo, and Patricia she'll be joining us. She had some conditions, but she'll probably join us. Congresswoman is office as a federal congresswoman. Catarina has the party graduated in nursing and specialized in hospital administration and public health, human resources, and she has in politics for the policies for the first childhood from the University of Carmem, just at UNO. Marcio Camargo, a chief at the Genial Bank, Dr. PhD in economics from Massachusetts Institute of Technology, and he's also professor at the Department of Economics at the University of Rio de Janeiro. Patricia Ellen, she is Secretary of Science, Technology, and Economics in the state of and she graduated in administration in Sao Paulo, and she has a master's from Harvard. She was the president of Brazil, which is a healthcare technology company from the United Healthcare Group, among other activities. I'll try to save time since we don't have so much time. Well, the subject matter panel assumes that there will be an economic recovery. That is still uh, dividing economists and their specialists and access to, because we're always to access. Access to health is what matters for citizens. Since the subject to access and economic development comes to me is healthcare funding, because without adequate, predictable funding, access to health is more difficult. And I'm talking about funding from two different perspectives, which are totally different. It's the funding of the public healthcare system and the private healthcare system. The funding of the public healthcare system is fiscal. Perspectives for recovery, when it happens, at- that should be at the budgetary execution of the federal government, the states and the municipalities that comprise the and the public resources. Well, the private healthcare system comes from the funding given by companies and families that purchase health insurance plans. So when we talk about economy, talk about the impacts that across industries, commercial and agricultural and service sectors, as drop to approach that Brazil long periods of recession, specifically 2015, 2015, which was by exterior imbalance. Talking about this system, when the budget ends, again, it's that's Syria that must which criteria should the light system in the system their system they do not admit light. That's a question. How to compatibilize the costs of private medicine, which also involve inflation with the payment capacity of this insurance. Are other aspects of management that refers to use resources, the efficient use of resources, and private, even though it might seem that it's senseless that the diagnosis of the funding of the health system. Well, of course, these are suggestions for our discussion. Could address as if you'd be so kind, Congresswoman Carmen. Thank you very much. Great colleagues or Mr. Marcio, our professor is just Marcio and Patricia probably join us. Used to say that the very subject of the discussion right now is challenging because the subject says improving access to health with the recovery of the economy. That is our big expectation and our deepest desire because we're still going through a much other COVID-19 scenario, but we should find out that at the public, probably in the private healthcare system, with the reverse demand that already existed in the pandemic, because it has accumulated the demands that were accumulated during the uh, 20 months that we didn't use most of the procedures. 60% of people were having difficulty in accessing cancer prevention exams or mammograms. And with that, the cases must be much more complex. The expectations for the recovery of the economy, if we look at the other countries, in spite of the difficulties that we all have in understanding the importance of vaccination and in the vaccines that we already have approximately 60% of the Brazilian population with the 2 doses with single dose. And that reflected on having new waves or difficult moments as we're seeing in other countries in this period. And fortunately, we are increasingly reducing the number of deaths and the number of hospitalizations. And this leads us to believe that the recovery of the economy and job positions may be a factor that will be facilitated for us in Brazil. But my biggest concern, and the concern of several colleagues that work with health, is how can we deal with the repressed demands that accumulated over time in the healthcare sector? Because there were several users of private plans that abandoned their healthcare plans with the pandemic and migrated to the public healthcare system. So how can we make do with the budget that we were given? Just adjusting what had been applied in the previous year, plus IPCA. What magic are we supposed to make? We're talking about complex procedures. We're talking about patients that need to have access to their diagnostic tests, their chemotherapy, their radiotherapy, oncological surgery, to medical referral, cardiac surgeries, and let's be frank, hernia surgery, for instance, that can be considered elective, but if it takes too long to have it, it can become complicated, become urgent. So this is the challenge ahead of us, which is to be sure that we'll have a sufficient budget according to Constitutional Amendment 95. And what's happening last week in Congress, there are discrepancies or not, but the PAC that may be providing us with a bit more resources in healthcare, or a budget of 134 billion reais for next year may be added to maybe added to another 5 billion, which is important. It's not that I think that we shouldn't have criteria for spending, but we approved uh, Constitutional Amendment 95, and we didn't did that. We didn't make necessary the required changes. We are losing more and more professionals, especially in the healthcare department, that are abandoning healthcare services because their compensation is not adequate for what they do. So we might have more difficulty if we continue to lose professionals, or if the hospitals no longer carry out procedures to budget an additional 5 billion in the healthcare budget. I consider that to be important, as well as the resources that should be allocated for us to guarantee the acquisition of more vaccines for next year and strategic assets to fight the pandemic. So with the recovery of economy, we wish and we also believe that the population may return to health insurance plans, but we're still uncertain due to the general difficulties that the population of Brazil has been facing. We just have to look at the news, Brazilians running after trucks with bones to feed their families, which is really, really sad. There are several things that we have to fight, but we should also leverage the suffering and the loss of lives to innovate in healthcare. That's why I believe that part of the challenges will involve consolidating telemedicine, because we're authorized to do telemedicine during the pandemic, but we have to change the legislation and allow remote appointments to continue to happen and to help with the lack of specialists, because it's not only about access to high and medium complexity procedures that we need. We also need specialized medical appointments, and that's pretty important. And using the equipment that was acquired, such as ICU beds for COVID, to maintain general hospital beds, and also expand the number of neonatal hospital beds and pediatric beds in regions where there are specialists we didn't have yet. But these are important changes in neonatology that is also a challenge that we have to understand and that we have to face. So this equipment should not become waste. It has to become an asset that should be used and maintained and used to expand and create new general hospital beds, both for adults and children and neonates. Another aspect, and we're here with Professor Marcio and Patricia, is how the Brazilian industry to reinvent itself so that we no longer depend on strategic assets such as a simple mask, and so that we're a bit more independent from basic assets of other countries in terms of basic uh, assets. That's my first concern. And I want to highlight this and say that we have to transform all this suffering and loss of lives, recognizing the importance and looking for secure funding and to believe in our institutes such as Fiocruz and TAP, and strengthen research in Brazil. Without a doubt, without strengthening these sectors, access to health will become harder. Strengthening our researchers and research in the country undoubtedly also needs to be the legacy of this pandemic so that we can reduce the lines of the public health system and also healthcare plans, because it's a reality. The lines are also long, and also the difficulty of access. Thank you very much. Congresswoman, apparently you're controlling your words because you're precisely on time. Thank you very much for your excellent participation. And at the same time, I will now straight I'll give the floor straight to our friend, economist Camargo. Thank you. It's a pleasure to be here at the FIS initiative and our scenario for Brazilian economy 2022. That's what I want to discuss, and also talk about health financing. Well, what we've been doing is, well, I think one good way to see it is that it's a very challenging scenario. There are two complicated things for the Brazilian economy for 22 that we'll have to deal with in the best possible way. What we've been doing is we've been doing our forecast based on the important pillars. Uh, One, respecting the cap on the public expenses. Why is that important to do that? Because this cap gives fiscal credibility to the country. What does that mean? It means that when you have a cap for public expenditures, whenever you have an increase in revenue, this increase in revenue cannot be used to increase expenses. It has to be used to decrease the debt, and that makes the debt sustainable in the long run. The result of that is that investors ask for a lower interest rate to fund the debt, and consequently, the cost of funding the debt substantially drops. To give you an idea, before the cap in 2015, the interest rate of the public Brazilian debt was on average 20% per year. Before the crisis, the rate dropped to 5% per year plus inflation. Now it's a bit higher. There is this entire discussion about the cap, and this decreases credibility. And since it decreases credibility, investors ask for a higher interest fee to fund the debt, and part of the resources is used to fund the debt. The second important pillar or scenario is this improvement in the pandemic. According to our assessment, if we continue in this path of improvement in the pandemic, and our expectation is that we will remain in that trajectory where Brazil has vaccinated most of its population, so we'll really continue to reduce the number of cases and deaths. We expects that people will be extremely euphoric to go back to normal. People will be crazy to go out, be with friends, have a dinner, and in summary, it's already happening. I don't watch soccer games, but I've been watching lots of soccer games on TV, and it's really pleasant to see how happy people are at the stadiums, discussing and talking to street vendors and so forth. And our assessment is that it will lead to a huge growth in the demand for services. Services are workforce intensive, and it will generate a huge increase in the use of the workforce. So between the first quarter of 2021 and the last data of unemployment, there's a drop from 14.7% to 13.2%. So our assessment is that we're going to reach year's end with an unemployment rate very close to the one that we had before the pandemic, which will really decrease inequality, especially poverty. And that's another very important aspect. And the third pillar, which is also positive, is the return of private investments. The concession auctions, the privatization auctions uh, carried out by the state and federal governments are extremely successful. We saw the privatization of Sadai and the sewage water system of Alagoas, the sewage and water system of Amapá, the privatization of five uh, highways, Dutra, the new regulatory framework of railroads. There are 24 demands for the construction of new railroads. So to summarize, there's a huge increase in investments going on in terms of these concessions, which is to say that Brazil is now becoming attractive again as a private capital. So all these things are a positive side, except for the pillar of the expenditure cap that was assessed this week. But there's another aspect which is very complicated, which is inflation. We have an accelerating inflation, and it's very hard to fight it. And an important part of this inflation is exogenous things to the global economy. It's a global problem. It's not only in Brazil. There's an increase in several prices. The production chains are having huge problems. We have problems related to a lack of materials and excessive demands, and the supply is not able to keep pace with that, and that's leading to inflation and increased interest rate. And this will lead to a reduction in attractiveness in 2022. Our scenario predicts a growth rate of 5.2% in 2021 and 12% in 2022, with an inflation of 9% in 2021 and 5% in 2022. Now, I want to dedicate the rest of my time to talk about the expenditure cap and healthcare funding, which is extremely important. Yes, Constitutional Amendment 95 that created the cap for public expenditures has an extremely goal. For the very first time, who has a budget that deserves the name budget, because for the first time, the Brazilian public budget has a cap up until the approval of Constitutional Amendment 95. The public budget still has no limit. The way it was that goal, primary super the government would send to the Congress a budget, the primary super goal. The Congress would increase the revenue expectations, and as a consequence would increase revenues and approve the primary surplus goal with higher expectations for revenue and expenses. New revenues would not always happen, but that was the case. This increased expenses were funded either by increasing inflation. We had several hyperinflations in Brazil, or by increasing tax burden. We had a very important increase in the tax burden in the last few years, or by increasing our debt. Our debt increased systematically since re-democratization till 2017. So these three factors no longer exist. Society no longer accepts inflation. Society no longer accepts increased tax burden. And creditors no longer accept funding the Brazilian debt. Now we have a cap. Just to say that, and I want to draw your attention to this. As of now, whenever you hit the cap, you got to choose your priorities. And it is fundamental for agents to understand that the scenario has changed. The way we receive budget has changed. In the past, we simply incorporate more expenses and then find out how to pay them. But now that's no longer possible. Now we have to convince society that it is fundamental for you to have a higher budget in healthcare, even if it has to be taken from elsewhere. So once additional budget for healthcare, in addition to the minimum established by Constitutional Amendment 95, it's fundamental for agents to be capable of arguing for the importance of a budget for health. And the same thing applies to education and not. There's a structural change in the way budget is set up in Brazil, and this results from the existence of a cap. But we'll have to get used to that as of now. And as long as we have the ceiling, when we hit the ceiling, we'll have to learn to justify our demand for an increase in expenditures, whether it is health, education, or anything else. I think that's an important aspect because it's very important for agents to be able to voice their argument as part of democracy. It's very important for us to be always ready to discuss the budgetary demands. So, well, this is my first presentation. I'll be available to you again. Thank you, and Secretary, welcome again. We were able to connect to our meeting. You probably were here watching most of his speech. That's self-explanatory. That was preceded by a speech where Congresswoman talked about the times ahead of us, and that was expected. This may become a dramatic situation with a full recovery of elective services and the request demands that entails, I mean, these challenges. She also associated that to good management of budgets and basically restrictions. So I want to take the opportunity and please to make your comments. I just want to remind everybody, it doesn't matter if we're talking about the expenditure gap, that our public health system is tripartite. I remember in the past when it was created, that it was called SUGES before it was SUDS, the Unified Centralized Healthcare System.
There was a more important role for the union in terms of managing the resources. And you, as a secretary, must know very well what it means, and perhaps we could better explore it. How can we deal with it in such a critical moment we're going through in the country? And how would you use more efficiency in this relationship with the states and municipalities? Secretary, the floor is yours and you have 10 minutes. Well, thank you very much. Thank you, José Marcio, and I also thank the Congresswoman. I'm sorry I was connected and then disconnected. I was on my way coming back from the city of Sorocaba. In the city of São Paulo, it feels like winter time. It is, we have torrid rains and very cold weather, and this is probably the effect of the climate change. And when we talk about the chronic diseases, we have other tropical diseases in addition to infectious, contagious diseases, which we've been dealing with during the pandemic. I was recently in the Amazon. They have a malaria event now. It not only for their public healthcare system, but I'm not familiar with any system in the world that has three simultaneous challenges that are so significant. So we age before we prosper. We have an incidence of chronic diseases that is observed in countries whose life expectancy is much higher, such as Japan and others. And then we have the third pillar, which are the external causes, such as violence, traffic. During the pandemic, we had a small reduction. Mostly this was due to external causes, and we also have had an increase in other causes of mortality, such as women abuse and crime against women. That's a very peculiar challenge in our country, and therefore we have three systems in one that we have to face. During the pandemic, we were tested to our extreme, and we realized how important it was to have a unified healthcare system. With our public healthcare system here in Brazil today, we have reached the records of vaccination speed that were not achieved in countries that started before we did. We also had an opportunity to expand our coverage in ICU beds. We also were able to get away with some paradigms. Things happened very quickly They were all induced by the pandemic. In the case of São Paulo State, in the beginning of the pandemic, we had 3,500 ICU beds. And we reached the end of the pandemic with a totally different number. And a lot of what we did, we had to redo. Governors were let, let afloat. We had delays in the payment of federal funds. And in the case of São Paulo, what the governor did from the very beginning was something that many people called very daring or crazy. We had an administrative reform during the pandemic, but that was very important because we um, were able to save expenses and had an increase in our collection. We have just launched another program, and we have a huge ability to invest at 13.3%, which is twice as much of what we had when we started our administration. There's no other country in the world with an accelerated resumption if they do not use technology and innovation. Here, as president of the National Council of Technology, we have a very worrisome situation. We have the lowest budget, and it was reduced to a third of what it was 2 years ago. In the case of the São Paulo state, we had an increase of 40% in 2 years, and this is the highest increase we've had. This is very important to guarantee that we will have vaccines, vaccine manufacturing, telemedicine, applied technology, and different fronts. The respirators, um, they were developed by the University of São Paulo. Today, I checked the latest statistics. We had 900 machines distributed to 17 states in the country, and therefore, we know that investing in science and technology and investment in healthcare system is not to be negotiated. I was proud to see that the week before last, we were in the Arab Emirates, and that's the country with the highest level of vaccination in the world. They have reached almost 90% of their overall vaccination. The state of São Paulo is the Brazilian state that is leading with the same percentage of vaccination and a complete vaccination system. We reached 72% of our overall population and 84% of the adult population. But in the Emirates, they distributed less than half of the vaccines we do here in Sao Paulo. We're talking about 74 million vaccines that have been administered. This can only be done when we have a system in place. I'd like to highlight this integration between states and municipality because the administration is done at a local level. We had to do unexpected things. To summarize, here in Brazil, we're going through a very concerning period. We do not have a macroeconomic policy. We do not have investments. With that, we do not allocate resources efficiently and are going through the chaos we can see right now with a lot of inflation and other problems we didn't have in the past. Unfortunately, we have to go through all of this again. I have traveled to the inner parts of the country, and it's very sad to see the inflation going up. I remember as a child, the currency would change. We always had an inflation. You had the money to buy your bread at the end of the beginning of the day, and then the next day, that money was not enough to buy bread. And so right now we have a very worrisome situation where we've had more inflation than we had in the last 15 years. We also had to improve efficiency by investing in technology and innovation. What happened with the governors of the municipalities I witnessed in my case was that we had to use our own resources to add to their budget. The governor personally headed a solidarity business committee with where we had over 35 meetings. We obtained 2 billion BRLs, and many of the resources we could not apply directly, including to purchase vaccine and tests and to buy masks. We used these private resources in this war operation we had during the pandemic. São Paulo state is going to grow over 7% this year. São Paulo has grown at higher rates than the rest of Brazil in the last 3 years. So what is the main concern now? We have to fight inequalities, but one state alone cannot solve our problem. We have to solve the problem for the whole country. We are receiving the same amount of immigrants we received decades ago. So if you walk around the city in São Paulo, you will see record numbers of people living in the streets, not only from our own country, but from neighboring countries. All this growth is not going to be enough, but this is something that we have to do. We must leverage new technology so that we can give the next step forward. We are advancing with telemedicine. You're probably following up. We are using private equipment at nighttime. And because this bridge between the state and a federative pact is not working very well, we hope to strengthen the relationship between the state and the municipalities. Also, public-private initiative bonds. If we do not work in an integrated manner, we will not be able to face the challenges we have ahead of us. Thank you very much. Well, thank you, Secretary. We have about 15 minutes. I know it's not enough. It's little. I'm going to make a proposal here. I will gather some observations, combine them into a set of questions. We have had some coincidences in what you mentioned, but we also had some disagreements. So I will ask our Congresswoman the following question, actually because she talked about public budget. If I understood you well, we have an expectation to have 150 billion BRLs in the budget for the public healthcare system next year. I was not able to confirm this data, but that corresponds to the same volume that was collected by the Brazilian system. So the private healthcare system has the same amount of resources to cover for 25% of our population. With the same amount of money, the public healthcare system will have to take care of 75% of our population. Of course, we have higher costs, and we also have costs that cannot be paid by service providers. And this leads to a total dearrangement, but this is our reality. On the other hand, the secretary has clearly mentioned now the question is the following. To obtain resources, we must have synergism between the federal and state and local systems, of course. And that is regardless of the political party, religious preference. It doesn't really matter. It is what Josias talks about all of the time. We need to think of all of our needs. So how do you see the possibility of resuming a pact, which is really a pact, and leaving aside our political and religious beliefs? And also, as Patricia said, how, because, integrating, unifying, that's something I do not believe in. We cannot integrate private and public systems, but some kind of collaboration, or in practical terms, we should have. And then Camargo is also free to comment upon what I just said. So now, Congresswoman, please. Well, I wanted to greet Patricia virtually because in the very beginning, when I joined, you were disconnected and then connected again. I'd like to say that I'm very optimistic about the public healthcare system. During the pandemic, it proved its worth, its capacity, despite any divergences. Everything was maintained. We did have some difficulties, but local and state level secretaries continued having their meetings. And this is another legacy that we must keep. If it weren't for our public healthcare system, we would not have had 60% of our population vaccinated. Yes, we did have difficulties, challenges in the purchase of the vaccines, but the actions of our employees in the three levels of government was very important. They worked hours and hours, and the number of ICU beds, there was a point in time where we had 24,000 ICU beds. This is the result of our joint efforts. There was a time when we were not able to purchase the equipment. The private initiative reinvented itself. We had companies that changed their plants and started manufacturing the respirators. And this is part of the support we had initially. Also has to do with funding by the private initiative, which supported our public healthcare system. So the tripartite issue is something that cannot change in our public healthcare system. Even if we know that today some municipalities are investing in healthcare. Some towns are investing 25% of its resources because that's where our citizens go to. And here, I would like to say something, and I'm not challenging you, Marcio. I am talking here as a nurse. I know that nobody can spend more than what they collect, but we cannot have a cap that would prevent us from moving on with what is essential. In other words, people's lives. To be able to deal with all of this, and our budget is really doing what our constitution amendment says. We have 84 billion, which will be invested in the prior year, plus IPCA. Our additional margin, the 25 million, because we changed the rules between June and July, and now it's from December and January. And the other resources, the 15 billions, which should be dedicated to buy vaccines for next year. so that we can continue our vaccination program. So this is our expectation and our hope. For us to be able to do this, we need, and Patricia mentioned it as well, we need to have the elective surgeries, specialized visits, and testing, because we're talking about a network here. If I do not have a visit with a specialist, I will not be able to close the diagnosis, and I will not be able to provide the care I need with the surgeries or other required procedures. Our challenges are many. That's why restarting is very important. Our public healthcare system is so important, and Brazilians trust vaccines so much that I do not think we are going to go through what other countries are. They have vaccines available, but they do not want to go get their vaccines with the booster doses. And I don't think they should be used for the elderly only, not only for those over 60 years of age and those with comorbidities. We will soon have to include every age group in the booster dose regimen. I'm very optimistic. I support our public healthcare system, and I believe that we can always improve our management, but management alone without further resources will not be enough. Thank you very much. We now have another challenge, José. It's a huge challenge. We only have 7 minutes. So it's almost like enough for you to say hello and goodbye. Okay. Well, the program is very simple. We have a public budget of 1,700,000,000,000 BRL, more or less, of which 160 goes to healthcare, as we just mentioned, approximately 10%. Isn't there a way to give more to healthcare and removing it from other areas? Because there is 92% of our budget that is dedicated to other areas. Is healthcare really that unimportant, or do you have to increase the overall expense of the public sector so that we can supply for the needs of healthcare? And this is a challenge that we've been going through since democratization. This is an important issue. So why, in the case of the Brazilian budget, if healthcare is so important, why do we only give 10% of our budget to such an important thing? This is the question here. We should dedicate a larger part of our budget to healthcare. It doesn't mean that we have to increase the overall expense. We should dedicate a larger part of our budget to healthcare. Before I turn over to Patricia, Zé, I wanted to make a question. This is something that, this is a global issue. The best healthcare system in the planet, the British system, NHS, has 5,200,000 Britons in the wait line waiting to have their procedures done. And the problem there is that the tax coverage is not enough in England. Their population is older, and the aging rate is much higher than in Brazil and in other European countries. This is a complex issue. Secretary, please. This is the same old challenge. And this is the discussion we should be having, actually, and this is not what is happening, unfortunately. The discussion today is more in terms of going beyond our cap. we're not focusing on the main strategies, policies, and priorities. And this is what our expectation is. I corroborate what was mentioned before by Carmen and José Márcio. Healthcare is very important. I'd like to remind you that the pandemic exacerbated our reality of inequalities throughout the country. The problems we're having in healthcare, we're unfortunately facing in education. Children did not go to school. They had to stay home. They have a huge gap. If this were an education panel, we would reach the same conclusion. We need more resources for education. But the problem is we do not have a macroeconomic policy because we're always pushing here and there, and people are getting squeezed. But what do we do with lower and lower shares? In the case of healthcare, and in the book I wrote with Professor Zotenberg about digital revolution in healthcare, 2 years ago, we had this challenge. If you have a simulation of the amount of resources we have and quality improvement, it means that with the current cost we have per inhabitant today, our healthcare expenses correspond to 10% of our GDP, if we include public and private sectors. And to do it in an optimal manner, we would have to dedicate 25% of our GDP, and we know that this is not feasible, and that's why I'm talking about investing in technology and innovation. I always tell the story of telemedicine. I've been telling the same story for years now. It doesn't really change. We had a huge advance in popularizing telemedicine in the state of São Paulo. Now we have a model with specialists and generalists on the other side, but there are also legal challenges, and this is something that must be solved. We've already talked about different technical issues, and I'm going to wrap up in a kinder way. Numbers are not people. I have a very large family, and I can see the reality of my family going through the pandemic and the reality of a large part of my family. Those who had COVID had good care, but they went without seeing their family members for days and days. In the private healthcare system, everybody had access to their own doctors when they were in the hospital. If I had any doubts about symptoms, I would have a video call with the pediatrician of my girls. They would ask me for testing, and I would take them to get their tests done. Why don't poor people deserve the same kind of service? We could solve many of the problems without having to spend more of our GDP. We need a macroeconomic solution, and beyond that, we need technology and management. That includes political will and a commitment towards inclusion. I agree, the public healthcare system is very successful. Without it, we would not have had the same vaccination rate. Brazilians, even with all the fake news, went out and got their vaccines, their shots. I think that if we do not do anything right now, we'll be creating an even bigger problem, though. We will need decades to solve it. Very well. This is great. Thank you very much. We're just a bit late. I don't think Josias will be very angry at us. I would like to thank you on behalf of Carmem, Zanotto, José, Marcio, and Patricia for their excellent comments. I know that this debate will not be over here. We need more dedication from our public personalities. I thank you for your comments. And we're now going to say goodbye to those who have been here with us. Okay, so quickly, once again, I'd like to thank you for the opportunity to be here discussing such an important topic. And it's important that we renew our hopes for those who need us so much. José Márcio, your mic is muted. I wanted to thank you for the opportunity to be here discussing such an important issue. I hope that with the end of the pandemic, we'll be euphoric. I hope the next year will be a happier year. Everybody going out together, talking to their families, getting together, um, playing soccer. I think that this would be a perfect way for us to resume our economy in 2022. And I hope that we're able to develop a new budget culture, which will be essential for us to have long-term growth in Brazil. Thank you very much. Secretary, I would also like to thank everybody. I wrap up reinforcing the importance of using new technologies, the importance of having a budget to science and technology. And I would also like to thank the professionals in these areas who were dedicated despite the scarce resources. Their work was very inspiring in this process. And also the population in general. Brazil does not have problems with fake news regarding healthcare. This is beautiful. Brazilians do not discuss their health ideologically. They can do so for other things, but in healthcare, that's a priority. Employment is another priority, and this is an asset. It makes us optimistic. It's an opportunity to use our resources in a more effective way, leveraging technology so that we're more and more inclusive and human. Once again, congratulations for your work to the FIS organizers as well. Okay, thank you very much. Goodbye.